Bruxism Part 3. These are the splint used for the bruxism patient. They give production for the dental and muscles. They are wear only at the night time. Next, moving on to pharmacological approaches. The etiopathophysiciology of SBE is still unclear. However, considerable evidence indicates that monoamine neurotransmitters, especially dopamine, play main role in the disorder. Recently, botulinum toxin (Botox) has been very successful in treating the grinding and clenching of bruxism. It can reduce the number of nocturnal bruxism events up to 12 weeks. So these are the best treatment for the bruxism patient because they give 12 weeks up to free from bruxism. Botox, botulinum toxins. They give at the muscles, Masseter and Temporalis muscles. Masseter muscle, the injection of the Masseter muscle in SBE patients use the same technique as that used for mesenteric hypertrophy injection. Botulinum toxin injection sites separated by 1 cm in the center of the middle third of the Masseter muscle. There are 2 injection points are used for most females and males with a narrow cheek with 25 units of Botox being injected. So botulinum toxin injection is injected into the Masseter muscle at the specific center. 1 cm in the center of the middle third of the Masseter muscle. Next, moving on to temporalis muscle, Lee et al. Have performed a study to simplify optimal temporal areas with a safe and reproducible approach for Botox injection into the temporalis muscle. They carried out detailed discussion and measurement of structure in the temporal area to visually represent a topographic mapping of postural relations among major anatomical structure such as temporal branch of the facial nerve in the temporalis muscle of the temporal area. Because it is very important, that is, facial nerve is passing that area. It is recommended to inject a total of 25 units of Botox into your 3 points within the 9 compartment of the temporal region.